share the link? Nila, are you able to share your screen?
It'll be a screen share.
And thank you, Nila. Thank you so much for doing this for us. Hope I wish all students benefit but it's okay. Let's see. We'll share the video to them. You start, Nila.
Okay, let me try and share my screen with you. Can you see that? Can you see it?
Yes.
Yes, okay. So yes, my name is Nilani. I work as a general practitioner in the UK. When Niveta told me to do the presentation on breast awareness, she said that there would be a mixed audience, so not everybody would be medical. So I've kept it as simple as possible. And the main aim of today is, I work in general practice. One of my main roles is disease prevention and promotion of healthy living. And I think health awareness and health education plays a really pivotal role in this. When we talk about breast cancer, when I see patients in my clinic and they come in with breast complaints, it causes me a lot of, it causes me a lot of anxiety.
Nila, 1 minute, can you put it in the presentation mode so that it comes in the full screen?
Yeah, 1 second.
Yeah.
Is that better?
Yeah, thank you.
Okay. So when patients come to my clinic and the presentation is a breast complaint, it causes me a lot of worry, a lot of anxiety, and that's because it can have quite devastating effects on their life. And I think the anxiety of having a breast complaint sometimes is bigger than the complaint itself. So main things on the presentation today is looking at some the incidence of breast cancer, the types of symptoms you can present with, examination, prevention, and the types of screening programs we do in the UK. Can you still see my screen okay? Yes, okay. So yeah. Breast cancer, I mean, I had a lot of numbers for the UK, but I understand not everybody is from the UK today. In 2018, there were 18 million overall cancer cases in the world, 9.5 million cases in men and 8.5 million cases in women. And of that, the most common cancer in women in the world is breast cancer, with nearly 2 million new cases in 2018. But it's not the most common cause of death in women in the UK, even though it's the most common cause of cancer in women. But it's only the 5th most common cause of death from cancer in women. So though the cancer numbers are increasing in the world, you might be worried that the cancer numbers are increasing, but the reason that the numbers are increasing is because the life expectancy is also increasing. You know, we have a world population who are living to a much older age, and so for every fact or statistic that you hear where the cancer numbers are increasing, it also means that more people are surviving their cancer diagnosis as well. So that's something that we should try, not just look at the numbers where people are dying from the cancer, but also look at the numbers where the people are surviving from the cancer. So if we look at general cancer deaths in the world, so this is looking at death and not the number of new diagnoses, you can see that breast cancer sits as the top, within the top 5. And this number of 611,000 is the number that we're trying to reduce, the number of deaths, by increasing awareness and making things like early diagnosis and management possible. And just a quick word on survival rates. Survival rates, as you can see, much higher in the developed countries, really very low in the low-income countries, less than 40%. And there are lots of different reasons for this. Lack of an early detection program, and for an early detection program to be successful, you need you need good health awareness, health education about breast cancer, empowering people to talk about the disease more. One of the other reasons for poor survival rates is a late presentation, a lack of adequate diagnosis and treatment facilities. But I think even if we can work on the early detection, I think the survival rates are greatly going to improve in the low-income countries. So this is the number for the UK. So you can see the number of cases, the deaths, a very good survival rate, 76%. But this preventable number of 23%, that's the one we're working on to try and increase the number of preventable cases, the number of cases that we are preventing. Okay, so whenever patients come to see me, they panic, they've seen a lump, they've seen a breast lump, or they've seen some changes, and they come to me, they're often panicked and they think, that's it, I've got breast cancer, or it's going to be really fast progressing, very, very anxious, very, very worried. But as you can see, when someone presents with a breast lump, there can be a number of different reasons for it. A simple cyst, an abscess, which can easily be treated with some antibiotics, a fatty lump which has nothing to do with breast cancer, or just even a lump that is sort of a lump, but it's a very benign, doesn't cause any problems, sort of lump, and obviously the scary one, which is the breast cancer. So this is what I'm often trying to tell my patients when they come in with a breast lump, to say, actually, there are lots of different things it can be, before I even do the examination, to say there's lots of different things it can be. Try not to worry about it too much. So looking at signs and symptoms. So these are the things that you might notice when you do a self-examination of your breast. You might, this is probably one of the most important slides, and I'm going to go through it quite slowly. Number one, you might notice a change in the shape or size. This is quite a difficult one because naturally women might have breasts that are different in size. One might be smaller, one might be bigger, one might be a completely different shape to the other, and that can be normal for an individual. What we're looking for is a change in that. So if you are someone that has a asymmetrical breast anyway, but then as you examine it looks even more different to how it looked before, that's what's important. The next one along, a lump. So a lump can mean that you have a lump under the skin, or it can feel like the skin around your breast feels a bit thickened. So it's not necessarily a lump, but it just feels a little bit abnormal. And then looking for any skin changes. I've got another slide that talks quite well about skin changes. And we can, I'll come on to that next. Or the other one is a redness or rash. And this can be anywhere on the skin, on your breast tissue, but we're looking specifically at around the nipple and in the nipple area, as this is more likely to be more likely to be breast cancer than if you get a rash or skin change, a rash in any other area of your breast. The other one, the next one is a retracted nipple. So a retracted nipple just means it looks like it's pulled inwards. Again, I've got lots of other pictures that you can look at, and it's not in where you would normally have expect the nipple to be. Any discharge that comes from the nipple, so it can be a bloody discharge, it can be a pus, a little bit of pus, or even some women present with a black discharge. All of these symptoms, as well as meaning breast cancer, can mean lots of different things. So, for example, having a nipple discharge can be related to any medication that you're taking, or just if you're breastfeeding and then you've stopped breastfeeding but then continued to have nipple discharge. So there's lots of different reasons why you can have it. The next one is pain. So pain in your breast or in your armpit. I've had lots of women present with just a little lump or some pain in their breast, in their nipple. Unfortunately, they've then gone on to be seen in the breast clinic and had a diagnosis of breast cancer. So what's important to remember is it's not just when we're talking about breast cancer, breast examination, it's not just your breast area. It has to be sort of all the surrounding area as well. And I'll come on to that in a second. And then lastly, some swelling in your armpit or around your collarbone. And I'll explain what the collarbone area is important as well. Okay, so this is a really good slide as well. It talks about the skin changes that you can expect. A very good website just talking about, because when you are trying to teach women about what to expect when they do a breast examination, it's really very difficult to explain what it is exactly that they're looking for. So if I was to say to someone, you know, look for skin changes that look like orange peel skin, very, very difficult to explain what that is. But this diagram is very good. So if you just, lemons come in lots of different shapes and sizes. This is the thickened area, the first one. Then the dimpling is you can see very clearly when, if you were to look at your breast on examination, you should see that it looks very, very smooth normally. I mean, reasonably smooth normally. And if you see that suddenly you've got that indentation where it looks pulled in, that alone is enough for you to have to go see your doctor about it. You don't have to have a lump. It just looks like it's being pulled in. Nipple crusting or the rash, like I talked about. You know, it might be a little bit of a red rash. It might be peeling skin. It might be peeling dry, cracked skin, anything like that. And if it's happening around your nipple, then that's something that you need to go and see your doctor about. Red or hot, again, can be lots of different reasons. Can be an infection, especially if you're breastfeeding, you can get mastitis, ending up in a red or hot swollen breast. But you know, it's better to just get it checked if you're worried about it. And the discharge, any type of new fluid coming from your breast, it can be discolored, it can be clear, it can be yellow, anything like that, because on a normal day, any discharge from your breast is abnormal. Skin sores, yes, you know, if there is an obvious reason for a skin sore, if you somehow cut yourself somewhere and it turns into a sore, that's fine. But if you've suddenly just developed a wound, it starts looking a little bit abnormal, yes, you need to go and get it checked with your doctor. Bump, that's an easy one. You've noticed a lump. Growing veins, again, that might be something that doesn't worry you too much, but if you've always had veins in your breast, again, that's fine. But if you've noticed that suddenly they're more prominent, or you know, if it's causing a little bit of discomfort, definitely get it checked. The sunken nipple. So the sunken nipple one is important because when I talked about the indentation, the dimple, it's not just in the surrounding tissue, but also in the nipple. You can see that from that picture that it just looks like it's being pulled in, and that might be all you see. If you didn't know that that was an abnormal symptom, you might just carry on saying, oh, actually, it just looks like it's gone in a bit, and it's not too much to worry about. But yes, that is something that you should look out for. New shape size, very obvious. And this is a very good one, orange peel skin. Essentially, you look at the skin, your breast skin should be nice and smooth, nothing on there to worry about. But if it looks like the skin of an orange on any part of your breast, orange, lemon, all of those, then that's something that you need to go and see your doctor about. I think where it says the red or hot lemon, you can actually see the orange peel skin on there very clearly. It looks like little dots where they've all been sort of. It just looks a bit irregular. But like I need to stress that all of these changes can sometimes mean nothing at all. So, for example, with the nipple crusting, the nipple rash, you might be someone that suffers from eczema, or even if you've never had eczema before, you could get a little bit of a rash or a cracked skin. It might be something as simple as just having eczema and nothing else. But there's no way for you to know that. And the safest thing to do would be to go and see your doctor to get it checked out. Please let me know if I'm going too fast or if none of this makes sense.
You're fine, Nila.
Yeah.
Yeah.
Okay. So this is probably one of the most important things is talking about self-examination. The timing is really important. So if you are, when you're going to do self-examination, I would say you need to do it regularly. So at least once a month, I would say definitely do it at least once a month. Timing is important because you don't want to do it the week before your period or the week of your period. The reason for that is, there's lots of hormonal changes happening before the period, during the period, and naturally you're going to have changes that happen in your breast as well. And you may have noticed that the week before your period, your breasts become a little bit bigger. They might feel a bit sore, sore and painful, and you don't want to be doing the examination at this time. You are inevitably going to find something that looks a little bit abnormal and it's going to worry you. The best time would be, I would say, after you've had your period, sort of the week, 2 weeks before you would go back on your period. And there's two different types of examinations you need to do. One, where you can actually look at your breast, looking for any of those skin changes that we talked about, like the dimpling and the orange peel skin. The next thing is you need to be able to actually feel and palpate your breast as well. So you can do it while you're lying down in bed. You can do it in examining the shower, wherever you think you'll be able to get a few minutes to yourself to do the examination. And when you're actually doing the examination, like I said, two different types of examinations. You need to look for any skin changes, and you need to feel for any abnormalities as well, because not all of them would get your breast. Okay, so when we talk about doing a breast self-examination, it is not just the breast that you're going to be examining. The reason for that is you may have heard of lymph nodes. Lymph nodes are where our body's fighter cells collect, and they appear like little lumps. So they might appear like little beads or little marbles that you can feel. And what happens is, if there's an abnormality in your breast, the lymph nodes can get swollen and can get bigger. So when you are doing an examination, you're looking for breast changes, but at the same time, you're looking to see if any of the lymph nodes that are around your breast look bigger or swollen or tender, anything like that. And the lymph nodes for the breast drain into your armpits. That's why examination of the armpits is really important. And also they can sometimes occasionally drain into the lymph nodes that are just above your collarbone as well. So that's why when we were talking about having a swelling in your above your collarbone, just above your collarbone, that's important as well.
Somebody is unmuted. Let me mute. Nivedita, I'm muting you.
Okay.
Okay.
We're back.
Yeah. Sorry.
That's all right. Okay, so when you're talking about the looking for any skin changes, looking for any skin changes, three main positions. One, you will definitely need to do this in front of the mirror, and that's really the only way to do it. You're just standing in front of the mirror looking for any asymmetry, any skin changes that you can see without doing any movements at all. The second thing you will need to do is position number 2, and then position number 3. And the reason for doing this is you're trying to move the breast tissue away from the underlying muscle, and in doing that, you will be able to see if there's a lump or any asymmetry or even any skin changes, like the dimpling that I was talking about. When you stand in these positions, the dimpling might become a bit more obvious than if you were just standing just with your arms next to each other. So this is what you would do. This is what I would start with, just examining in front of the mirror. The next one is examination is feel. So you can do that lying, even in the shower will be absolutely fine. And the best way to do it is with the side where you're examining, for your arm to be behind your head. Again, that just lifts the breast tissue away from the underlying muscle and makes it easier for examination. When I see patients in clinic and I do the examination, you need a really systematic way of examining so that you don't miss any areas. So those are the 3 different recommended types. So you could start with a circular examination. You start at the top of the breast and you go in a circular motion right the way to the nipple and then do the rest of the areas. You can start from one end and go to the center, and you just have to keep going. It's sort of in a star shape, but I find this way sometimes it might be easy to miss something unless you're very, very careful to make sure you don't miss any of the areas. And lastly, just going from top to bottom and then back again. I'll try and see if I can do. I can get you show you again at the end how best to do the examination. So talking about risk factors, family history is the obvious.
Nila, one question. Sorry. So these examinations, right? Is there any age limit that people should when they should start?
No, there's no age limit. Obviously, you don't need to start when you're very, very young. I would say anybody over the age of 18, you can absolutely start doing breast examination. It's probably a little bit easier to speak to someone who's over the age of 18, but I would say even the whole about breast awareness and the whole aim of getting people to be examining and getting to know their body early. So even a 16-year-old, you can start teaching them about doing the examination. And there is no harm in starting early because it is painless. It doesn't cause any worry. It doesn't cause any discomfort. But definitely, I think from the age of 18.
Okay. Thank you.
I would. Yes. Okay. Yeah. So one of the main risk factors for breast cancer is family history. There is no, yes, this a completely defined risk factor. So you've got family history, you've got lifestyle risks, environmental risks, the usual multifactorial cancer risks. But in breast cancer, especially, family history is key. So if you've got someone in your family, first degree relative, that you think that has had breast cancer, who's had an early death resulting from breast cancer, really, really key that you are more aware than the general population and you do the examination more regularly than others, and that you have a smaller threshold for seeing your doctor if there's anything that's worrying you. If there is something that's worrying you or you think looks abnormal or different, if you go to see your doctor, they examine and they say, actually, then everything is fine. That's better than you thinking, oh, I don't think this is anything serious, and letting there be a delay before you see your doctor. As well as family history, there are other risk factors that increase your chance of breast cancer. I don't want to go into it too much because I know that everybody here is not medical or clinical, but things like the age at which you start your period, the factors like having a late menopause or a late age in which you have your first child, other factors like contraception, all of those can increase your risk of breast cancer. And this is all to do with how much exposure to estrogen that you've had throughout your life. Again, I don't want to go into too much detail about it because then it gets too clinical.
Nila, one thing, can you address the relationship between breastfeeding and reducing the risk?
Yes, I was just going to that breastfeeding actually has a protective effect on breast cancer. So that's something we always encourage my patients to do. And one of the reasons that the breast cancer numbers might be increasing in developed countries. We were talking earlier about survival rates being lower in developing countries where there's no access to medicine to care or late presentations, one of the reasons it might be increasing in developed countries is the fact that breastfeeding is not as popular, or it's becoming less popular, and so that protective effect that you've had from breastfeeding actually goes down a little bit. So that's why the numbers are increasing in developed countries. Luckily, it still continues in developing countries. So I think that's where the protective effort is important. So we looked at family history, where that's important as a risk factor. But as I was saying, you know, the medicine that I do, where I work in general practice, one of the most important things is prevention. And with prevention, lifestyle factors are key. So like we were looking at low survival rates in developing countries, where it was because of poor access to medicine, one of the reasons of high numbers in developed countries is because of lifestyle factors. And some of those are, as you can see, 21% of all breast cancer deaths in the world can be attributable to lifestyle factors, and that includes physical inactivity, obesity, and being overweight, especially looking at increased saturated fat intake, and lastly, increased alcohol consumption. Unfortunately, in developing countries, alcohol consumption rates are going up. They've always been reasonably high in developed countries, and all of these factors are the reason the numbers continue to be so high in developed countries, despite there being better awareness, better access to medicine, and better management of breast cancer. So one of the other factors, as well as education, health awareness, one of the other factors that's key in reducing breast cancer numbers is screening. And this is probably the factor that varies the most around the world, because I know that in this is the screening program in the UK, screening mammogram done every 3 years for women aged 50 to 70. So that's 20 years of 3-yearly mammograms, and the reason for doing that is that is the age, that's the common age range where women are diagnosed with breast cancer. And you don't want to start doing the screening too early, because you might end up picking up changes that might not cause any harm, or would be self-resolving, especially in younger women. So this is the one factor that I think varies a lot in different places in the world. For example, I'm not really sure what if there's a screening program available in India or Sri Lanka, but I think certainly what I would say is, I know that in India you can pay to have a full medical screen that I know a lot of people get done regularly. And I think if you're going to do something like that, especially if you're between this age range, I would definitely request to also have a mammogram done. I'm not sure if it's added in as part of the screening program, but I would certainly definitely request to have that done as well. Okay, so what happens next in the UK? If you've done your examination and you've noticed the change, you would ask to see your GP, probably me. You can ask for a female. It's very easy. If you want to ask for a female doctor, you can take a friend or a relative with you. You can ask someone to be there during the examination. Again, I'm aware that this is not the case in different parts of the world. And what would happen is your doctor would do the examination, and depending on your risk factors, depending on what they find on examination, the management options can be watch and wait. So, for example, I have a lot of women who present with breast lumps. I examine them, and if it feels like a harmless lump, I might say, let's wait for one more cycle, one more period, and then if the lump is still there a month later, come to me again and I can examine again. Or if it's a breast lump where we think something that can be treated, so for example, if we think it's a little abscess, or if the nipple rash looks eczematous, then we can treat it as if it was eczema. Or if we do the examination and we think it looks suspicious, then we often refer on to the breast specialist for them to do further investigations. But again, like I said, that's the pathway you would go down if you came and saw your GP within the UK. But in other countries, you might be able to directly go to see a breast specialist if you've noticed a change, without having to go through your general practitioner. But yeah, that's something that you can do. And lastly, I think probably the most important thing is you have to be aware that breast cancer is also, there is an instance of breast cancer in men. Not as often, not as high in numbers as you find in women, but it's not just sort of encouraging women to examine. If a man finds a lump around the breast tissue, I would wait no time before you see your GP or your doctor, because it's often a lot more serious in men than it is in women when they find a breast lump. Very common in men to have breast cancer if there is a strong family history of breast cancer, and if you are a woman who has a family history with somebody, a male family member having had breast cancer, your risk is a lot higher, and I would definitely get it checked as soon as possible. And I think this is what I was saying. I think from 18 years old, from 18 onwards, I would encourage everybody to do an examination regularly. And I think part of that, one of the most important things is making it a norm to talk about it. I think if you were to say, if you've got a 16-year-old girl talking about breast cancer, talking about doing regular examinations, and even if you are able to casually ask, oh, have you examined your breast recently? Have you done the examination in the last month? And I think it should be less of a taboo, and the more we talk about it, the more awareness that will be. Even if it's if you've got a female partner and you ask them, have you examined your breast recently? I think that's going to make some big changes. That was it, really. I didn't really have anything else. I know I sort of whistled through that, but I'm happy to go through any of the slides again if you wanted.
This is for the Indian audience. The incidence, like Dr. Neela was saying, incidence of breast cancer per 1 lakh population is significantly lower in India. But so, for example, about 5-6 years ago is the last statistics we have incidence of 1.5 lakh or 150,000 cancer per year diagnosis. So it's roughly between 1.5 to 2 lakhs new cases diagnosed per year. But here is so the incidence per 100,000 per lakh population is several times lower than in Western countries where white population are more at risk for breast cancer. But the shocking part of it is the death rate is significantly and shockingly high. It is basically, like Dr. Neela was saying, 50 to 60% compared with the number of diagnosed. Not in the same year, the same 50%, 60% don't die, but on average, number of deaths by breast cancer is about 50 to 60% compared with 15 to 20%, less than 20% in the Western world. So my question to our medical student here, Sangavi, is what can you do to reduce the death rate from breast cancer? Dr. Neela said how to prevent breast cancer, like encouraging breastfeeding, and then how to, but then what is the reason why the incidence of death per number of breast cancer is significantly higher in India, and how can we handle it? Sangavi, do you have any idea?
Early diagnosis and treatment is the best angle.
Right, early diagnosis, correct. So,
Yeah.
and what are the things we can do for early diagnosis to improve in India?
Screening angle.
Before the screening, you want to create awareness.
Yes.
So, media, people, all, women's groups, social groups should create awareness. Okay, good. So once you create awareness and then you encourage them for doing what? What are things you will tell the population? Say you are the collector, IAS officer for a district, and you want to create a breast awareness program. What is it that you want to do with your population?
We can create awareness about breast cancer, like what are the risk factors, and
Right.
self breast examination.
Exactly. You want to teach people to start doing self-examination. Ipo,
Yeah.
Dr. Neela Katna Madri, you make a video with either you can use a male model, or you can even use a diagram, pictures, tell them how to do the self-exam, and then have a screening program. Right? Anybody
Yes,
over a certain age, you say you should have a routine medical examination by a doctor. So that means we need to have access for women to more female doctors, because most people don't want to be examined by males. So these are the things. It's such a dramatic difference in death rate. 60% versus 15-20%. So that is my comment for all the public groups, women's groups, social groups, doctors, women in India. Thank you, Dr. Neela. Wonderful presentation.
No problem.
Other students, anybody else have questions, please ask.
யாருக்காவது question இருக்கா? Question? Yeah.
I have a question. Now maybe I can ask. So in the breast cancer, I mean, if the patient is diagnosed at the stage 3 or 4 or whatever, right? I mean, that is a separate part in the body that can be removed. I mean, usually it is removed when people diagnosed and then as part of the treatment, right? Why will it takes away the life, even if it is at stage 3 or stage 4? Is it too late, or the cancer cells has already spread into the body, or what is happening? If you can enlighten, that will be helpful.
I think I'm going to try and see if I understand. I think sometimes you don't realize that how far it's spread. So even if you pick up somebody, stage 3, 4, wherever, and you do a mastectomy, you try to remove as many of the infected lymph nodes as possible, you can never be 100% sure if it has how far it's spread. And that's why I know that we have, even post mastectomy or post chemotherapy, radiotherapy in the UK, we have a really very long surveillance program, so that even after you've been like I said, diagnosed, managed, you might have annual follow-ups with your breast consultant, and even regular mammograms with the breast consultant. And I think that's one of the things that is always worrying about breast cancer, is that if you've been diagnosed with it, you're never ever fully rid of it. You always have to be careful that it could it could come back anytime in your life. So for example, you know, when I've got my patient list and I've got the past medical history written down for a patient, and if there is a concern, there is a diagnosis of breast cancer, that is always something that you have in the back of your mind, regardless of what the patient presents with. So somebody may have been diagnosed with breast cancer, 20 years down the line, they present with back pain, and I'm still worried that this is the breast cancer coming back again. And I have to think, I have to have a lower threshold for investigating that back pain because they've got that history of breast cancer. So I'm thinking that I hope that's what you meant by why is it that they are not rid of it, because it's difficult to know how far it's
partly it is. My another part of the question is right, what makes the patient to die? You know, so usually in other types of cancer cells, you know, like it is spreading across the body and then it takes away all the cells and things like that, right? So in the breast cancer, it is only it is part of the body. What I'm saying is it is still not attached to the critical parts of our the body parts, right, to make our human life running. So why does patient die when they have a breast cancer?
So
how can they die? You know?
Yeah, I think I mean, I don't want to say anything that I'm not 100% sure about, but I'm sure it's because of a malignant potential, where it
okay.
is metastatic potential, where it metastasized. Sorry, that just means that from the breast tissue, it moves to other parts of the body.
Mm-hmm.
So if it invades a blood vessel, it can move to different parts of the body. And that's what I meant by, 10, 20, 30 years down the line, somebody presents with the back pain, you're worried that you missed a resurgence of the breast cancer, and it's now been found in their back rather than anywhere else.
Okay.
Yeah.
Okay, good. Thank you. Thanks, Nila. Any other questions, students?
We have a good 16.
Yeah.
Ma'am, I have a question, ma'am.
Go ahead, sir.
Hello. Okay. Ma'am, in India, the traditional dress is sari and jacket is in snow. So most of the ladies, up to I have seen, they have kept the money purse, which is made up with rexin material, inside the jacket. So I have come to understand, is the rexin material is one of the factor to causes the breast cancer?
I'm not sure.
Let me introduce Mr. Armugam is one of our pillars in India, and he is a biology teacher for 25 years plus, and it's a fantastic biology teacher. He has been teaching biology, and so he's a very passionate in biology.
I mean, it's a very good question, because, for years we didn't know that smoking caused lung cancer. So actually, unless there's been a specific study done about talking about environmental causes and specific materials or chemicals, I'm afraid I don't know the answer to that question.
There is rumors about cell phone causing cancer.
Yes.
Radiation from cell phone.
Yeah, and we all sleep with, I know I do. I sleep with my phone right next to me on the bed. So maybe in only about 20 years, we're going to find out the effect of sleeping with the phone next to you.
Yeah, already they said that it's not a good practice to keeping cell phone next to our head, especially when sleeping. You get like good long 6 to 8 hours.
Yes.
Apart from some chemical factors, ma'am, is stress may causes such kind of cancer. Also, some hormonal imbalance like the prolactin imbalance also maybe causes breast cancer, or the enzymatic imbalance.
sorry, were you saying that the enzyme imbalance does?
I mean, the prolactin also induces the secretion of milk, no? So if the hypersecretion of prolactin may causes breast cancer, is a question.
Sometimes they say there's a slight risk, isn't it, Nila? With increased prolactin.
Yeah, but I think you might need to find out what is causing the increased prolactin in the first place. Because I don't think having a breast cancer alone causes the prolactin to raise, or just having a raised
His question was the other way around.
Yeah,
whether it increases the risk, but there is definitely one hormonal effect. Estrogen, hyperestrogen, increased level of estrogen increases the risk for breast cancer, definitely. And there is other question is there any risk from birth control pills for breast cancer?
Yeah.
That is a relevant, good question, sir.
I mean, I think I sort of touched on that, which is, you know, women are exposed to estrogen all through their lives, and when they're having their periods, or when they are having children, they have a reduced exposure to that estrogen. So, for example, a woman who has 5, 6, 7 children actually inevitably has a slightly lower risk of breast cancer because she's had that longer period of time in her life where she hasn't been exposed to estrogen. Whereas somebody who doesn't have any children has a slightly higher risk compared to that woman. And again, that's why with the contraceptive pill, so combined pill, as well as endogenous estrogen, which is estrogen that you find in your body, estrogen that comes from external sources can also increase your risk. So when you're taking the contraceptive pill, you might not be having your period, but you're still having that external estrogen that can increase your risk.
And that is how breastfeeding also reduces the risk.
Exactly, because when you're breastfeeding, you know, it's like a natural contraception, isn't it? And you don't have your period. Well, most women don't have their period in that time as well.
Yeah, your question was on the prolactin. Estrogen. Estrogen தான் stimulate பண்றது prolactin receptor. So what happens? அவங்க tamoxifen கொடுப்பாங்க. Anti-estrogen receptor. அது வந்து prolactin block பண்றது தான் அந்த tamoxifen வேலை. So அதால வந்து அது connection இருக்கு. ஆனா அது directly involved இல்ல. ஆனா estrogen வந்து induce பண்றதால தான் அது நடக்கும்.
ஓகே சிஸ்டர். ஓகே. ஏன்னா அதோட ரிலேஷன் இருக்குமான்றது தான் என்னோட டவுட்.
ஆனா அது தனியா ஹையா இருக்கான்னா அதால இருக்காது. ஆனா வந்து estrogen induce பண்றதால தான் அது கூடும். So already estrogen increase ஆகிறதால risk வருது breast cancerக்கு.
ஒன் மோர் டவுட் சிஸ்டர் நீங்க கன்வே பண்ணுங்க. அதாவது லேடிஸ்ட இருக்கிற ஒரு டவுட்ஸ் எனக்கு தெரிஞ்சவங்களே எங்கிட்டயே சில டீச்சர்ஸும் கேட்டுக்கிறாங்க, ஃபீமேல் டீச்சர்ஸும். அதாவது டியூரிங் த பிரெக்னன்சி தே ஆர் ஃப்ரீக்வென்ட்லி டேக்கிங் த ஸ்கேன்ஸ் அல்ட்ராசோனிக் வேவ்ஸ் ஸ்கேன்ல. அது போல எக்ஸீட்ஸ் ஆஃப் அந்த ஃப்ரீக்வன்சி வேவ் லென்த் இருக்கும்போது நம்ம ஆஃபன் அந்த சாட்டிஸ்ஃபேக்ஷனுக்காக நம்ம ஸ்கேனிங் எடுக்கும்போது இட் மே பி காசஸ் த கேன்சர். They having the doubt.
No, ultrasound waves do not cause cancer, hormonal cell.
Okay, sir.
But it causes heat. So excessive ultrasound exposure to the baby can increase the baby's temperature by a small fraction. So the advice is do only what is necessary. Do not do ultrasound just for seeing the just for fun of it. Some people want to do just for taking pictures. That is not encouraged because ultrasound does cause heat. It's not malignant causing. Like radiation, X-ray beam does cause cancer.
Extreme range of Röntgen maybe causes the cancer.
Yeah, X-ray beam is a risk factor. If you do a lot of chest X-rays, that is a risk factor, or even a lot of chest CT scan. But ultrasound itself is not a cancer-inducing.
நீங்க என்ன சொல்லலாம் என்றால், if they're worried அவைகளுக்கு breast cancer வரும்னு ஸ்கேன் செஞ்சால், because நீங்க breast cancer உங்களுக்கு இருக்குதான்னு பாக்குறதுக்கு அல்ட்ராசவுண்ட் யூஸ் பண்றது. So you can tell them actually அது கோர்ஸ் பண்றேல அது டயக்னோஸ் பண்றதுக்கு யூஸ் பண்றது. because இப்ப யூகேல 3-point test மாதிரி செய்வினம் உங்களுக்கு இருக்குதென்றால். First one is the mammogram, which is the X-ray. The second one is the ultrasound. Actually என்றால் சில lumps or changes X-ray ல show up பண்ணாது. So X-ray யூஸ் பண்றவேல், ultrasound யூஸ் பண்றவேல், மற்றது வந்து biopsy யூஸ் பண்றவேல். So நீங்க சொல்லலாம் actually அது diagnosisக்கு யூஸ் பண்றது. So பயப்படுறதுக்கு ஒண்ணும் இல்லையண்டு.
ஏன்னா அந்த எக்ஸ்ரே இதை ரிலேட் பண்ணி தான் அவங்க டவுட்ஸ் எங்கிட்ட ஒரு லைக் இந்த சாப்டர்ஸ் எடுக்கும்போது அவங்க ரைஸ் பண்ண கொஸ்டின் ஜெனரலா பீப்புளும் ஒரு அதான் அவங்களுக்கு நம்ம இனிமே ஃபர்தர் அவேர்னஸ் கொடுத்துக்கலாம் இல்லையா?
Absolutely. X-ray is a risk factor for cancer of all kinds.
Yeah. Thank you so much, Nila.
Thank you. Enjoyed it.
Thank you everyone for attending. Thanks a lot.
Thank you very much. It was very informative session. I hope students liked it, and it is they can share with their family, friends, and everybody. Thank you so much, Dr. Nila.
Thank you.
You're welcome. Thank you for having me.
Yeah. Bye.